Good afternoon, ladies and gentlemen. We want to thank everyone for joining us this afternoon on this webinar today from Dude Solutions. This afternoon, we're going to be talking about 3 ways to streamline work during this COVID-19 outbreak. We'll do a quick introduction. I'm going to walk through everyone who will be joining us today for our call. First off is going to be Taylor, an implementation specialist on our senior living side. Then I'm Braden Witt. I'm a product manager over for the Works Hub. And then joining us as well is Rachel, our implementation specialist. Taylor's going to be talking to us today about how to schedule your team's work to help your day-to-day processes run a little smoother, whether you're facing staffing shortages or new challenges that are arising every day. He's going to cover that for us. I'm going to be talking about ways you can access your work from anywhere and use those remote tools to be able to administer your facility no matter where you are. And then Rachel's going to talk to us about how to report on all your daily work from infection control to housekeeping, rounding, and more. Before we kick off here, we'll go over a couple of things. The dude is beside you. We know these are unprecedented times with emerging challenges every day. So we want all of our clients and non-clients and everyone who's joining us today. We're putting a lot of resources out there. If you check at dudesolutions.com, we've got a resource page where we're constantly posting new content, links to sites, and getting resources out your hands. When we send out this PowerPoint at the end of the day today after this presentation, there's a slide with some links that you can follow to some additional resources as well. Remind everyone a few things. So Dude Solutions is fully work from anywhere right now. So if you call our support line, if you open that live chat, or if you're emailing support, you can rest assured that someone's going to be there to answer your call, receive that chat, as all of our staff are now working mainly from their homes. The Dude's been supporting a work from home structure for years. We have all the technology in place and the resources in place to get your help. If you're within our product, up in the top right hand of your screen, you'll find that drop down for all those additional resources. And another way that you can rest assured as you're running the Works Hub in your facility facing these challenges today is our rock solid uptime here. So over the last few years, you can see that we average above that 99% range for our uptime. So you can rest assured as you're moving these very delicate and needed day-to-day operations into your Works Hub that data will be there as you need it. So this time I'm going to go ahead and we'll pass it over to Taylor and we'll get kicked off here and start digging into this.
Thanks so much, Braden, and thank you to everybody for taking the time out of your day to either attend our session live today or listen to our recording. We really do appreciate it. There's so much certainty right now, these hectic times. We're all trying to find a new normal. With the CDC, CMS, government, White House, local governments making seems like daily changes, it's just a lot to deal with. Whole states or whole cities at this point, probably whole states in the near future, are being shut down and given those shelter in place guidelines. But one thing that we do know is that you can't shut down. The industry that we have all chosen to work in doesn't allow for that. So what I want to talk about with automation today is making your job just a little bit easier. And every little bit easier can really just improve your day, improve your record keeping, and improve the your experience on a daily basis and allow you to do more work. Looking forward, and speaking of looking forward, when you're looking back on this in 6, 9, 12 months, and you're looking at it through the lens of your CMMS, and you're reflecting on this time, you're going to want to know who did what work was related to COVID-19, what was done to prevent things, what work was done as a reaction to COVID-19, what worked, what didn't work, who did the work, and that's all going to be very important. And that's the benefit of having a CMMS. So getting every scrap of work that you do on your campus, whether it's big or small, into the system is incredibly important. And there are going to be some common themes that we talk about, tools and resources throughout this session. All 3 of us will mention, and one of the big ones is reporting at the end of the day. And Rachel's going to spend a lot more time on that later, but it all comes back to reporting. In talking to our clients, our main focus has been on 4 major areas for automation. Some of the solutions may differ because I'm talking specifically and using Works Hub solutions, but the goals and principles of what you see should be available in some capacity in whatever CMMS you're using at this point to track your work. So just understand that though the solutions are different, the goals and principles maintain for however you're managing your work. Okay, so first thing I want to talk about today, or the group of things I want to talk about today are scheduled work orders, templates, project templates, and QA and surveys, and some ways that we can automate those tools in your daily life. Scheduled work orders are not just for PMs. Why do you need more scheduled work orders? Most people consider scheduled work to be for PMs. Those daily, weekly, monthly, quarterly, annual tasks that you do on your boilers, generators, air handling units. But there's so much more. Making sure that you're just getting a daily reminder to do simple tasks. CYA at the end of this time frame, knowing who did what. Having that reminder that you were the one who did that work. Accountability, just knowing that the work has been assigned and is out there for someone to complete. And then once it's completed, having a name and a timestamp attached to that work. Build maintenance rounds to build daily processes that are going to be followed by you or a member of your staff to make sure that those things are done and have those things be clearly defined. Housekeeping, very important there as well. You probably, I feel like the biggest things going to change are those common area cleanings that you might clean. Maybe do a light cleaning on once a day, maybe do a deeper clean once or twice a week with some sort of frequency, stepping up the frequency and obviously intensity of those cleanings. Something on that front is you may be tempted to just edit what you have currently, whether that's increasing the frequency of your deep cleans or just changing the scheduling or changing the existing tasks. I would encourage you not to do something like that because I would recommend building new additional COVID-19 specific tasks that will run on a regular basis. Again, so that when we're looking back through the lens of your CMMS, seeing the work that was done, you're able to identify that work as being related to a precaution with COVID-19. Scheduled work is also a team sport. We get everyone involved. We're able to assign the work to the right person. If someone's out, you're able to cover, make sure that work's being done, and creating a paper trail. And just kind of, at the end of the day, some of these things that are out there are probably things that you're doing anyway on a daily basis. So write it down. The things that you're taking it upon yourself. I was talking to a client earlier. You walk into a room, you wipe down the handles, every handle in the room of every room you walk into. If you're doing that as a precaution, and that's great. But if you, God forbid, have a fever tomorrow morning and don't come in, who else is going to pick up that task and do it? So that's why getting these schedules into the system, having them generate on a regular basis is going to be incredibly important for the long-term success of your communities and facilities, and hopefully trying to tamp down this virus that we're all running from. And finally, just creating a paper trail, making sure that, again, when we look back, we know what was done, who did it, when, and why. Building your scheduled work orders, getting them in the system. And this goes for templates as well. I'm going to talk extensively about templates as we go through. You may notice that I get very excited talking about templates because I think that they are fantastic. I am nuts for templates. Don't be afraid to overdo on instructions. Give every detail that you think that someone who's never done that job would need to know to do it as well as you do. So overdo on instructions. Also, if people sometimes, not saying every time, but people sometimes tend to not do it if it's not written down. So, again, CYA, write it down. Make sure that people are being held accountable to all the tasks that are assigned to them and doing the whole task. In the Works Hub, we have a specific set of options within our work orders called task list tools that are interactive. You have a couple different options for those, such as a checkbox, which is just a validation that the work was done. You can also scan a barcode that would kind of confirm that you are where you say you are, whether that's a location barcode proving that you were in the front entryway wiping down those entry doors at 9 a.m. or add an asset. So scanning a barcode, knowing where you were, what time, name and a timestamp attached to everything. Also pass fail with corrective action. So if things pass, great. On a failure, corrective action work orders are automatically generated. So those interactive tools are solutions in the Works Hub. I recommend those whatever options that you have available to you if you're not using the Works Hub to have those. Also the ability to say that a work order cannot be completed until all the tasks have been acknowledged, whether that's checking a bunch of boxes or scanning barcodes, making sure that those things are done. Again, accountability. Using those, I use keywords throughout. People who hear me talk a lot know that. And having having a reason for the steps that you lay out. Be considerate in the way that you lay the steps out. The task order. For example, moving from low risk areas in a cleaning to high risk areas, so that you're not taking the germs and spreading them further. Rather, you're kind of pushing out of the room. So, be thoughtful when you're actually setting up those the order in which you're completing your tasks. So I've got an example also using templates as well. Templates, again, nuts for templates. Build it once is really the key word, the main takeaway from templates. Build it once and build it ahead of time. Because you're going to have access to work orders, schedule work orders, requests, and even project templates. So that work that you want to have access to when something happens and you're going to do that work, you don't want to take the time to build the work order. When you build a template ahead of time, it's already created. So it's already in the system. It's ready made for you. In an example with a project, it might be generating a number of work orders. We'll talk more about projects in just a moment. But with scheduled work orders, having those things in place. The great thing about templates with scheduled work orders is that you can reuse them. And what I like is you end up with consistency of work. Every time, every location that it's used, you get the same steps, the same task list is associated with it, so that the job's going to be done the same way every time. So consistency of work. So it's upfront work. It's getting it knocked out ahead of time so that when you need it, it's there. So build it early and build it once. So this is an example of a scheduled work order template that I went ahead and created as a precaution round, making sure that we're taking, and I incorporated some of our interactive task list items, such as scanning a barcode of the entry. And then I give specific instructions, so wiping down the high touch points on the entryway doors, both sets of doors. Make sure we're using that single-use disinfectant wipe, and then we're actually disposing of that wipe. And then we go to the next one, we do the same thing. We've also got corrective action. I would attach wash your hands to everything that moves because that's the battle cry of everyone right now. But you can see here in the center, I was able to replicate this so that I know that we're doing this work twice and we're doing the same exact work twice a day, but I only had to build it once using a template. So use templates because they're going to save you time in the long run. Put in the time to build a good one and then just use it over and over again. Okay, so projects. I am nuts for projects also. I'm nuts for the Works Hub in general, as you can tell. I'm pretty excited about it. But projects, depending on your system, you may not have a project function, as it were, for us, but really at the end of the day, what projects are in terms of the Works Hub and our solution is a way to group together related work orders and track them collectively. And at the end of the day, report on them. So that's rolling out time and costs, duration. You can easily check the status of that work. So really it's a way to group together the work orders under a single umbrella. What you can do also is think about oftentimes people will think about, well, why don't I just build one work order with a bunch of task lists, tasks associated with it? To me, a task list associates a number of steps within a single job. Work that's grouped together in a project may be handled by a number of areas of responsibility. You could have a contractor doing one of the jobs. You could have housekeeping doing a job. You could have IT doing a job. So it allows you to divvy up that work with multiple work orders, and also keep track of them collectively. Another nice thing about grouping the work orders together is it can help you to identify, as you're checking the status, can identify bumps in the road that may be slowing things down. So you can see what needs to be done to remove that and get things going. Building project templates ahead of time as well. As I said, build it early so that when you need it, it's available. Something like an isolation tent. If you have that positive diagnosis that you need to go ahead and isolate someone on a short-term basis, you click a button one time, and the 4 work orders that are associated with building the isolation tent and setting that up for long-term success is automatically created. And I've got an example of what that's going to look like here in just a moment. But also, to reiterate, including multiple departments and tasks assigned to multiple people in a single area on a group of work orders is fantastic. You can see here we've got an example of what in the Works Hub, what grouping work orders together looks like. We're able to identify the work that needs to be done. We can see the status of those work orders here, easily tracking the bar and the collective time tracked. If you have a general template for a job that's got 10 work orders associated with it, then this time you need that template to only include 8 of those work orders. It's very easy to remove those before you actually generate the job. So building project templates to me is a dream scenario. And again, especially having it in place when you need it, so that you don't, maybe you'll never need it. And that's really the hope. If you end up building something and not needing it from a reactive standpoint, but having it when you do will be very important. The last piece I want to talk about is QA and survey. And this is a piece that touches everyone, because it's so vital that we ensure our teams are consistently doing what they are following our procedures for infection control, especially in these times. And we want to make sure that you are doing your quality audits even as our times are so hectic. That's even more important as with the new infection control procedures. Having new procedures means that you need to check it more often, and then you can actually see what needs to improve, and then you can track the improvement over time. So if when you did the round today, you did your inspection today, we got 65% of the things done correctly, but then we did it tomorrow, we got 75% done correctly. So being able to have that tangible data to refer back to is very important. It's not just you walking around and looking in the corner or looking at the desk to make sure that it's been wiped down, that the hand sanitizer is full, and that all of the high touch points have been wiped down, that people have masks available and ready and are interacting with patients and residents in their proper way. Having that written out, outlined, and having a procedure to follow, and not just follow, but a regulated procedure that everyone's following. And then we can also track improvement. So making sure that we're doing that. If you're already doing EOC rounds, maybe you punch it up and add new items to those EOC rounds. But making sure that you're having identifiers built in that these are for COVID-19. These are the COVID-19 procedures as opposed to what we were doing normally. And you're going to be able to look back on that down the road and see what was done and why it was done. This is just a quick example of what some of our clients are doing right now. You can see we've got average scores. We've got a couple different versions of the surveys that are being done, including are the alcohol-based hygiene products available for staff? That just simple questions. But we've also got corrective action that generates based on any of this, whether that's a work request or an acknowledgement to someone who doesn't work in the Works Hub. But being able to track not only that the thing was being done, but if it wasn't being done correctly or accurately, that we had corrective action. We know that we took steps in the event of a failure to correct it. And that's that's where the full circle of actually auditing and QAing your staff comes into place, is having the correction after a failure. So that's a number of things that can be done to automate your facilities and communities, hopefully take a little bit off your plate. Again, I know it's a little bit of upfront work, but in the long run, it will make your life a little less stressful, knowing that you have these tools in place, generating on a regular basis, and knowing that if you aren't able or someone isn't able to pick up things in order, or staff starts calling out, that work is generated automatically in the system, and we can track and reassign it as needed. The other great thing about being in a cloud-based system is that it can be accessed from anywhere, and how that really comes into play and be turned into a huge advantage for each of you as you manage the work sub. I'm going to let my friend Braden talk about that a little bit more.
All right, thank you for that, Taylor. Yeah, so one of the, as Taylor just mentioned, with the WorkSub being a fully cloud solution, we're not behind VPNs. There's no barriers to make it easier to be able to work from anywhere. So we'll dig in here a couple tools that are built into the WorkSub to make it easier to be able to administer your site from anywhere, manage multiple parts of your building from a single location so that you're able to limit access, and ways that we can take technicians from having to have multiple touch points again, with shared keyboards, shared mice, and make some automation system improvements so that you can start automating work assignments and work approvals. And we'll touch on budget so that way you can start to track these budget needs that have been put on your organization. Something we're talking about when it comes to communication. In times like these, communications become more important than ever. They become essential to keep an operation moving with any kind of pace and smoothness, even in uncertain times. Over communication, I would say, becomes even more essential. So regardless of the solution you're using, finding ways to over communicate with your teams, keep people together. It keeps gossip from spreading. It keeps misinformation from getting out, and it ensures continuity to your operation from the day to day. So with Bulletins, we're going to talk about some ways you can use full screen mode to put up monitors around your facility to be able to communicate with all of your users, no matter where they be, and within multiple roles in different situations. So all your departments can share information without having to go to touch any device. You can just have that up on a large screen, and how you can empower your command centers now to be able to get these bulletins out and share information in the real time. And when it comes to work requests, we'll talk about some ways that you can do some messaging within our product, so that way when requesters go to put in a request, they know exactly what they can expect from your team. With budgets, we'll look at the ways, maybe some ways you didn't know or within the WorkSub of how you can track those budget demands that are being put on your facilities, housekeeping, biomed, and other departments that you're running within the WorkSub. And we'll give a little plug here for those of you who are using our security app, that the security app really empowers you with that to encourage transparent communication, maintain accountability, and increase those reporting rounds and easily track on those. So with Bulletins, you're able to, what we're seeing some of our clients do is they're setting up monitors throughout their facility connected to a computer in full screen mode. So you might have in the ER, just an ER bulletin board where you're able to create a user role. So just those users see any bulletins might be coming up. Within these bulletins, you're able to put in links, images, all sorts of graphics. So that way you can clearly communicate the message you want to get out. In this example here, we're linking to an internal site within a hospital. And this becomes a really powerful tool for your command center. So that way you're able to empower that command center to clearly communicate across the hospital. So within your settings panel, if you're asking, well, how do I roll out bulletins across my facility and not give everyone too much access? When you go into your user settings within the WorkSub, there's a section called Bulletin. You can disable all of your other boxes to where just a user can add a bulletin. You then can go add those users directly to that role. So your command center maybe can just roll out your bulletins that way. So you can create then a bulletin that goes to just your ER manager, just your OR manager, EVS, and all of those different locations throughout your hospital. When it comes to putting in requests, right now we know that priority is being put to different places. So within our requester screens, you're able to put up these great messages. It means that you don't have to send out emails. There alleviates meetings so that when a requester goes to ask for something, they can get that day-to-day update of what's going on within facilities world. If you're not taking requests or if requests are being delayed, you can lay that out for, we're seeing biomed departments that are putting up messages on exactly which template to use. When it comes to life support devices, we know there's a great strain right now on ventilators and those kinds of high-level pieces of equipment. So a great way to build those requester templates to be able to automate that work getting directly into the hands of technicians. Budgets. I know, right now as hospitals are being, and senior living communities are have great demands put on them to start rolling out, parking lot testing and isolation units. Within the work sub, you're able to attach those work orders to budget items. You're able to assign assets to these budget items. So you can see here in this example that we have clients that have built in billing codes and budget and account codes, so that with every item that you're pushing through in this time of response, if you're putting up a parking lot tent and you've rented that tent, you're able to track that expense down to that line item and be able to report back on that to build better long-term disaster recovery budgets. Now, how can we automate the system to make it a lot easier to get your teams, keep teams working? If you've got team members who are starting to call out sick, or as we're limiting capacity within our facilities of where you can and can't work, we'll look at a couple tools here of ways that you can automate work to get it in the hands of the proper technician at the proper time. So one of the best ways to do this is with Teams automation, to automate your team assignments based on some work routing rules. So the steps of this are really easy. You're going to build out your routing rules within the product first, and then you can build that team so that way you can put in that staff schedule. And through this time, if you have lots of staff who might be out because they're ill, or if you're just cutting back staff, you're able to build out these staff schedules so that your work's automatically going to route from request into the hand of a technician. You can bypass those any approvals that might be needed. We'll look at that in a moment. So that way you can skip out having to have administrative layers to get work done. This way that work can get right in the hands of technicians and get work done quickly and efficiently. So as we're building templates, I know Taylor talked a lot about templates. We all love templates because templates mean that you have unified data, you have trackable data. So one of the best ways to do this is with our requester template. This is an example that we've got a parking lot tent set up. And so this isn't a normal location. So you can go in and add that new location and get a template in so that team can quickly get a request into your facilities department should they need something. And as you build this template, you'll see that box there for allow request to use this template to skip the request status. This means that as soon as that request goes in, if you've got a round robin and a team set up, this can route right to the hand of a technician who's at work and ready to take work and get this work done quickly. The next thing I would highly encourage is to get your technicians using their mobile devices. Get the work sub in the hands of people via the mobile app. In areas with limited or no Wi-Fi, running on your iPhone or your Android device, you're guaranteed to be able to get that access to the work sub and keep getting work done, get requests in, and make work happen. It also eliminates those workers from using multiple people using the same device. So we're putting steps in place to encourage good infection control measures. You can manage your inventory, you can manage work, everything you can do on your desktop, you can pretty much do within the mobile app and cut back on those shared devices. So now that you've got your templates built, you've built all these rounds, you've built your budgets, the next big part of this starts to play into reporting. How do we start to put things in place so we can retroactively look backwards, or how do we can maintain what we're doing today? So Rachel's going to jump in here and she's going to walk us through some ways that we can start building reports and use the reporting module to get work done.
All right, thank you, Braden. So some of the things that we're going to talk about today in regard to reporting are going to be around data standards, being able to utilize saved favorites for those reports that you're going to be running on a more consistent basis. And then we'll also go through some recommended reports that we're starting to see clients lean on during this time. And I'll also show some examples of survey and inspection reports. So as Braden mentioned, now that him and Taylor have taken you through a lot of those insights on how to manage your day-to-day work, this is where we're going to tie it all together and talk about the key component of reporting. So whether you're using our solutions, paper, or another solution, the basics are all the same, and that's that we want you to be able to use the data you're collecting to manage your workload, to both improve your day-to-day operations, plan for the future, and really be able to publicize on your successes. So you want your CMMS system to be a reliable, easy, and go-to tool to help during these times of crisis. So when you're asked to provide data on the impact of COVID-19 at your community, that's where the Works Hub can help. So with that in mind, I've pulled out a few reports that I want to walk you through. Again, that folks are starting to rely on. And we're going to be showing these based on our system and talking about a few points of consideration in terms of how you want to set up your data. But again, the essence of what we're talking about is reporting that can be applied to everyone. So getting into maintaining those data standardizations, so that's a big thing, that's setting you up to be able to accurately report. So as you're communicating with your teams, it's important that you want to keep everyone on the same page when it comes to the data. So that could be potentially, creating a custom source of work or additional categories and subcategories in your Works Hub site so that you can utilize those custom pick lists to apply them to work that's, specific to COVID-19. So if that is being done, then making sure that you're taking the steps to notify the end users, so notifying your requesters that there is a new source of work available for them to choose from, notifying the people on your facilities team or your environmental services team who are accepting requests and turning them into work orders, making sure that they're aware of those additional categories and subcategories. So some examples there, being infection control or disaster preparedness for source of work, or setting up emergency response or medical crisis response for your category. So another thing, it's not a bullet point that I have up here, but we thought it was important to mention. It kind of goes back to, when Taylor was talking about setting up your scheduled work orders, utilizing templates, and really making sure that all of your work is being captured. So in addition to making sure your work is being captured, it's also important to make sure that you're accurately assigning work orders. So that can tie into, if you do happen to have an outbreak at your community or your hospital, you're going to be able to easily track who may have been exposed on your facilities and environmental services team, because if you had them applied to any work orders, you're going to be able to easily utilize your reporting to find out, which locations within the community and where those workers were. Another thing to... Oh, go ahead, Taylor.
Can I make one more quick point? And I'm really sorry to jump in. But, talking about data standardization is super important because reporting is the silver bullet to all this, and it makes all of the things that we do, that you do, worthwhile. So just kind of thinking about the adage of the information that you pull out is only going to be as good as the information you put in. So making sure that you have that data standardization and you're calling things the same way and the right way every time is super important.
Mm-hmm. Yep, absolutely. Thank you for that, Taylor. And, again, along those same lines too, some additional things to keep in mind around the whole concept of data standardization is potentially making sure that you add any additional locations that are needed. So, any outside tents that you may have to set up, like for drive-through testing or isolation tents, making sure your parking lots are captured. So any additional areas on your campus where there may be the potential for a work order, make sure that those locations have been entered. And also, communicating like a standard naming convention. So if a requester or anyone at your community, if they do put in a work order that's COVID-19 related, making sure that they're including that as part of the request description, because that's just going to give you an extra added layer of criteria to be able to search on. And lastly, you know, I'll kind of leave us here with, you know, just really making sure that you're encouraging and maintaining the policy that everyone must submit their request through the work sub. You don't want to let that go by the wayside, because if everything is still flowing into the work hub, that's what's going to allow you to properly track and prioritize everything, and it's going to allow you to report on that impact. So we want your CMMS should be, you know, a constant during this hectic time. You know, it's there to help kind of provide a sense of normalcy, because if staff are already used to it, you know, you want to maintain that, because it's going to help keep you organized and efficient. So really moving into leveraging your reporting, the first thing I want to start off with here is being able to set up your favorites and email subscriptions. So as you know, Braden kind of touched on earlier, like the concept of remote administration, you know, that's not something that some of us may be used to during this time. So being able to access your data from anywhere and still continue to communicate with your team and have a pulse at what's going on, this is where report favorites and subscriptions can become your ally. So if you're properly tracking your data and the data standards are being followed, your reporting options, you know, are going to be endless. You're going to have that data at your fingertips. So if there are certain reports that you're starting to run on a daily basis, if there are certain things that you need to run daily or weekly, you know, to kind of send them up the ladder, being able to set them up as favorites and establish report subscriptions, it's going to be a huge time saver, and it's going to help you avoid a lot of headaches. So as you can see here from the screenshots within the work sub, your favorites are going to live on that very first sub tab within your reporting icon. There's going to be several links available to you. One of those links is manage subscription, and you can see where you can set up that recurrence for how often you want that report to go out and to who you want that report to go to. So getting into some of the top recommended reports, one of the first ones here that would be good to take a look at is the PM monthly forecast. So this is an asset-based report. So, you know, pending that you've got your assets in the system, they're being linked to your scheduled work orders. This is a good way for you to stay ahead of and on top of your preventative maintenance. So you're going to be able to use this report as a way to proactively see what's coming up as an opportunity to get some things done early. You know, so the whole concept here is you want to try to stay ahead and not fall behind, you know, kind of during these hectic times. Another good one is your task list results report. So this can be a really great report to review and make sure that all of those additional cleaning tasks and extra preventative measures that you're doing, really making sure that all of those tasks are actually being completed. The simple work order listing. So just like the report says, it is a simple list of work orders. However, this is one of those reports that can become very, very powerful. So it's a report that can be ran many of different ways. So it makes it a really versatile report because it can be used in so many ways. So for example, you know, being able to isolate your data based on like those custom sources of work, like if you only want to, you know, review completed work orders that were done within the past day that were infection control related or that were emergency response related, your simple work order listing report is going to be a great go-to there. It's also going to allow you to monitor how much time is being spent on those jobs. Lastly, another big one here, response time analysis. So for all of these COVID-19 related jobs, these are probably jobs that are taking a higher priority, and you're wanting to make sure that they're being done in a timely manner. So your response time analysis is going to give you a good pulse on making sure that you're keeping up with all of those COVID-19 related jobs. And then also in regard, if any of you do have our security module, so being able to review and send out the daily log report, that's another really good one that can help ensure that any additional rounds that you're doing throughout your campus or community are being completed. You know, and there's even the potential to create a an additional incident category where you could create and monitor COVID-19 related incidents. And you even have the option to make incidents private if that's not something that you want to share with everyone who may be receiving that report. So on the next slide here, I do have an example of what the PM monthly forecast report looks like here. So for the PM monthly forecast, you'll see there along the left-hand side, that's going to represent all of your assets. And then you have the months of the year up there across the top. And then you're going to have your indicators on which assets have, a quarterly PM coming up, a weekly, an annual, whatever the case may be. So this is what's going to give you that proactive view to see what you have coming up and what can you potentially do early. We also wanted to point out that we do have a section on our help site that goes over a lot of these recommended reports. So if you're ever feeling like you're not getting the results that you want or the report isn't looking like you think it should, this is a really, really great starting point to make sure or get some guidance on how you're setting up the filters and making sure that you're setting them up properly. So I would highly recommend checking these recommended reports out. When you do receive the slides from today's webinar, any of the orange links that you're seeing throughout here, those are going to be links that you can click on. It will take you directly to the resources so that you don't have to go hunting for it. And then of course with reporting, if you're, you still need some extra help, please don't be afraid to reach out to our support team. We're here to help. We can always point you in the right direction. So moving into being able to monitor those survey and inspection efforts. So Taylor talked a lot about earlier about how to set up those survey and inspection templates. So now from the reporting perspective, kind of thinking about how we all know how long the virus can remain on hard surfaces and in the air, completing those additional inspections and doubling down on those common area cleanings are something that are happening daily. I think we can all agree that it's vital that you ensure your teams are consistently following those infection control procedures. And, although you may be busy dealing with, a whole bunch of other things, a key component of that is to make sure that you're continuing to do those quality audits. Because if you're doing those quality audits, that's what's going to allow you to, randomly inspect employees to identify problem areas and training opportunities based on the scores. And then you can also run your deficiencies report to see where you may need to refocus some of your efforts and improve. All right. So last but not least, just wanted to also point out some more visibility options. In addition to reporting, a couple of additional tools that may become really, really helpful is your Pulse tab and your calendar. So if you don't have time to run a report or you just need a quick snapshot to see what's going on, your Pulse tab can be a really great place to see who currently has a timer running, where are they in the community, what building are they in, what floor are they on, who currently has time logged for the day, and then of course a quick place to view your recently completed work orders. On the calendar side, so your calendar can be a really neat thing to see, especially from the environmental services perspective of, okay, what are all of the routine cleanings that are going on for the day? Who has breaks in their day where they can step in and help out with the additional preventative measures, that you guys are faced with now? And then also your calendar is another way to quickly reassign work from one person to another if you have to do that. So with all of that, just wanted to reiterate again that we are here to help. I know Braden talked a little bit about the support hours earlier. So again, another reminder, we're just a call, email, or chat away. We're available Monday through Friday, 8 a.m. to 6 p.m. Eastern. Please feel free to check out our help site and also the coronavirus specific resources that we're compiling. And then also, if you're wanting to find out a little bit more in depth on how to set up some of the features that we've gone through today, our implementation team does offer a series of live virtual classroom training sessions. So we do have some really good sessions coming up. So next week on the 24th is when we will be running the project session. So you can learn how to set up those project templates that Taylor was referring to. On the 25th, we're going to be running the basic reporting class. So if you need some guidance and direction on how to set up some of the reports that I was talking about earlier, that would be a great class to join. And then for those of you that are interested in how to leverage that survey and inspection module for maintenance or housekeeping, we're offering this one 2 separate dates. So on March 24th, that's going to be geared more towards our healthcare facilities and hospitals. And on April 1st, that's going to be geared more toward senior living communities. So on our virtual classroom training registration page, you'll be able to register and sign up for those classes.
Yeah, and for those of you who just didn't get enough of my voice when I was talking earlier, I'll be teaching the reporting class on the 25th and the senior living survey class on the 1st.
We all love listening to Taylor. All right, so with that, Braden, I'll turn it back over to you and see if we have any questions.
Fantastic stuff there, everyone. Again, we want to thank everyone for taking some time out of your day today. I know with all the demands that are being put on healthcare facilities, we appreciate you taking some time today. And we ask if you find things that are working in your facility you want to share with others, please reach out to that support email and give us your side. Give us a call. We love hearing ideas from what's working out in the world, from what's working at your facility that you might want to share with others. We're always an open door to receiving those questions. Anything that you would like to share with us, we're always open to make that available to a broader audience. We have a couple of Q&A questions here that we'll hop to real quick. The first one, do you have any insight into what kind of data would be required to get approval or apply for FEMA funding? At this time, I would recommend track things. Get those work orders tracked, get those categories and subcategories built, and understand the work that you're doing. So as FEMA starts to make things available, or as other government agencies open up those funding channels, maybe for short-term or long-term things, that having a robust report there to be able to track what you're doing, the time spent, running those timers from within the mobile app will become really important in those times. I think that's really the only question we've had come in. So again, we just want to thank everyone for joining today and taking some time. We have some web resources that'll be going out after the webinar today, so you'll be getting an email, so look out for that, with some great resources here to help you navigate these untrying times, and some good resources as you build those templates, as you build those reports to be able to help and guide you. And so with that, we'll go ahead and wrap up and just remind you that the dude is beside you, and we're here for any way that we can help support your organization. Please reach out, and thanks for joining us today.
Thank you, everyone.